I believe that architects, if we step out of the boundary lines from our buildings and onto the streets and think about how people are accessing our buildings, we're going to be able to make tremendous change on how this profession is practiced moving forward. My name is Shafaq Choudry. I'm a UCLA graduate student with a background in architecture, transportation, and public health. I think the most exciting thing is seeing that these professions are coming together in a way that's unprecedented. Transportation, public health, and design is the three amigos that have not been tapped into before. And I believe that if we can bring that in a successful way, then we're going to be able to turn around what are the challenges that are facing social, behavioral changes in this country. The federal government is understanding the intersection between transportation and public health for lifestyle changes, for increasing physical activity in our daily lives. I think it's upon us as designers and architects to come into that conversation proactively so that we're not just responding now to health challenges, but we're part of the preventative conversation as well. Suppose there's a community that's wanting to bring in a new building design, such as a community center, into their neighborhood. Now, if this is done with only considering the site context and not looking at the surrounding infrastructure or the surrounding means to actually have residents tie into that new building that's brought into neighborhoods, I'm starting to see that as a failure, and I don't mean to be so blunt about that, but how people are accessing our buildings has everything to do with the actual experience that we put into our designs inside of buildings. So taking consideration into access of these buildings, I think, is where architects need to step up and get into these conversations about policy, about transportation and public health.